So my name is Ammar Ahmed. I'm a second-year PA student about to perform a simple interrupted suture. So for this patient, they came in with a laceration in the forearm, and basically what we're going to do is 2 simple interrupted sutures. We're going to start off by assessing the wound, making sure there's no signs of infection, because you don't want to suture over that. We're going to irrigate the wound, make sure we have it cleansed, and then drape the patient off too. So applying, the ointment and everything to begin the procedure. So what you want to do is get the needle driver in your dominant hand. Got my fingers through, my thumb and my ring finger through the loops. So we're gonna go in at an angle, go through the skin and get into the soft tissue as well. Make sure you come out adjacent to the side you went in on. And pull out. Now I'm going to do a surgical knot to secure the suture, and then cut it off and start the other simple interrupted. Gotta grab it by the end and pull in the opposite direction, just like that. And realistically you would do about 4 or 5, but I'm just going to do 2 for demonstration purposes. And then grab it like that again and pull on the opposite side, and that should bring the skin together. Like I said, I'd do it a couple more times, but now we're going to do the second one. Okay. And as mentioned, grabbing the dog ears and making sure, once you're coming back to get these sutures removed, you just pull on the end, so that way you don't get the suture going through the wound site and causing an infection. Alright, so now I'm going to do my second one. Same way, dominant hand, going in, grab the forceps, pull the skin out so you can visualize everything. Alright, going in and coming out directly adjacent to the opposite side. Making sure you have a good bite. Pull, and usually in a person, their hands will be moving like that. Right. And then same thing, get a good loop around and grab the end of the tip and pull. You don't want to do it too firm, because then the skin can overlay on top of each other. And then get the other side. Like I said, you do this about 4 or 5 times to make sure the suture's secured. I'm just going to do it 2 for demonstration purposes. After the procedure is done, you cut the ends of it and inform the patient about any, if there's any bleeding, just apply pressure. You can put antibiotic ointment on it if needed, but as of it doesn't seem like you would need that. If you start seeing some signs of infection, such as any discharge, any odor coming out of it, come back, let us know, call the office, and we'll get that taken care of. But yeah, that is a simple interrupted.